The Presidential Task Force on COVID-19 has shared guidelines and steps for travelers coming into the country to prevent new imported cases of the virus and to sustain the successes recorded. The PTF coordinator, Dr. Sani Aliyu, at the daily briefing on COVID-19 in Abuja, shared measures to curb spread of the virus as international flights resume. He, however, said that there were clearly implications for not following the travel protocol, and this was done in the best interest of the public health of the country. He noted that the PTF remained committed to transparency and good governance.
So this is why we have established an online registration portal as part of our risk mitigation measures following the publication of our travel guidelines for international travelers coming to Nigeria, and in order to make that experience as smooth as possible for the passenger. The portal itself is a tool that ensures travelers coming to Nigeria register on the platform and complete all the necessary steps required to comply with the travel guidelines that we issued on the 5th of September this year. So what are those steps? This specifically applies to passengers outside Nigeria, not those leaving Nigeria. If you're outside Nigeria, the first step you need to do when you are coming into the country is to go and have a COVID test done. This test has to be a PCR test. We do not accept antigen antibody serological tests. It needs to be done from a certified laboratory in the country you're in, and we already have a list of accredited labs from countries that we initially had issues with their results. The test needs to be valid for no more than 96 hours. Preferably, the closer it is to the time of boarding, the better. Passengers without a valid PCR test or those with a result older than 96 hours will not be allowed to board the flight. Once you have your COVID PCR result and it's negative, you go onto the portal, which is nitp.ncdc.gov.ng, nitp.ncdc.gov.ng, and you register on the portal. When you register, you will fill the pre-boarding health declaration form. This is the same form that people used to fill manually in flight or on arrival in Nigeria. After you fill the form, you will be asked to upload your COVID-19 PCR result that's negative. If you upload a positive COVID-19 PCR result, you'll still not be allowed to board. It has to be a negative result. Once you upload your result, you will then go ahead to fill in where you are arriving to, whether it's Abuja or Lagos. We are making subsequent adjustments to the portal to enable us find out exactly where you will be on day 7 after arrival, whether you will be in Maiduguri or Port Harcourt or Calabar, so that you can choose a sample collection center within the city that you'll be residing on day 7. For the moment, we have laboratories across Abuja and Lagos only, but we've made arrangements with these laboratories to make sure that when you pay, wherever you are in the country, they will arrange for a sample to be collected from you. But we are really encouraging private laboratories outside Abuja and Lagos to work with their state governments in order to get onto the platform and provide improved access to testing for travelers. If you encounter issues with payment, this is a card payment. If you have international card, it will be easier for you to choose the dollar option rather than the naira option. And there will also be a button for PayPal for those that are unable to use the normal Nigerian banks for paying. If you encounter issues with payment, you may still pay at the airport when you arrive. However, just to make it clear, it is much faster for you when you arrive Nigeria if you have already done all these 3 steps and you have paid. It's a very smooth process. If you don't and you have to pay at the airport, then you should be ready to experience significant delays in the process of clearing. Once you arrive in Nigeria, you will have a barcode or a QR code that you will present at the airport. They will be able to download your information, confirm whether or not things have changed since the last time you completed your health declaration form, and ask you to proceed to immigration for clearance. Since starting this process, I am pleased to inform you that travelers arriving to Nigeria have been using the International Travel Portal, and we've actually collected data on how the portal has been used thus far. None of the funds that's being paid to the laboratories is going to either the NCDC or to the PTF. A small fraction of that will be going to the state governments where these labs operate for the purpose of admin, logistics, and data management, and the rest goes to the laboratories.
The coordinator also urged laboratories outside Abuja and Lagos to please key into this, because the more laboratories the country had operating, the easier it would be to drive down costs and improve competition, he said.
It's not a procurement process, so you can have as much as 100 labs in Lagos and Abuja providing this service. The 3 key requirements are you have to be licensed by the Medical Laboratory Science Council of Nigeria. You have to have NCDC validation and optimization in order to function as a molecular lab. And then thirdly, you must be accredited by the state government that you are operating in, because your test results will feed into the state numbers. We know that there are still some issues with the platform that we are resolving, but overall, at the moment, it appears to be working well for the vast majority. When we started using the platform in the first few days, 90% of all travelers were able to use the platform without any issues. Nevertheless, we do not want to place undue restrictions on Nigerians coming into the country that genuinely cannot use the platform, which is why we put on hold the requirement for having a QR code or barcode when you're arriving in country. But we are working towards making sure that a QR code can still be generated where you have not finished payment, provided there's evidence that you have attempted paying, so that at least we will have your health questionnaire and you will have your COVID-19 PCR negative result electronically available for us to be able to review and go back to if there's an issue.